The main complications that we see in AML in children and adolescents relate to the therapies that they receive. Um, Most children will receive therapies called anthracyclines. These are medicines. This is a type of chemotherapy that is very effective against treating the AML cells and killing the AML cells, but it also has associated toxicities that include cardiac toxicity. So in order to cure children with AML, we need to give them high doses of anthracyclines, and that means that about 1 in 5 children are going to have some degree of cardiac dysfunction during their therapy. Some of those children, not all of those children, but some of those children will continue to have some degree of cardiac toxicity well beyond the end of treatment. Um, we don't use these anthracyclines lightly. We use them because we know that they're the best available therapy. And we use them in conjunction with monitoring cardiac dysfunction, often in collaboration and consultation with cardiologists or specialists in heart function, and sometimes with medicines that we can use to reduce the toxic side effects of the anthracyclines, of the chemotherapy. Another medicine that's commonly used to treat AML is something called cytarabine. Cytarabine is another form of chemotherapy that we give in very high doses during treatment. And even when we give patients with AML antibiotics to prevent infections, still also about 1 in 5 will experience some significant bacterial infection, often in the bloodstream, during the course of their treatment. Children with AML need to be monitored very closely, so they are often admitted or have very frequent clinic visits during the course of their treatment. They're often given prophylactic antibiotics and antifungal treatments to prevent bacterial infections and to prevent fungal infections. And we do a lot to create a protective environment for children to undergoing AML treatment to avoid unnecessary exposure to community-acquired infections like the flu and viruses, cold and flu viruses. The risk of infection and cardiac toxicity is high in patients with AML, and monitoring and awareness is key to making sure that kids can navigate the treatment safely. There are other side effects that are associated with treatment, including kidney problems and liver problems. These tend to be temporary, though sometimes can provide long-term problems as well. For patients undergoing bone marrow transplant, there are a lot of other side marrow transplant, including, as I mentioned previously, infections, but also other problems, including growth and endocrine problems. And I would, because the list of toxicities for this type of intensive treatment is so long, I would certainly encourage you to talk to your physician about what is the greatest risk for your child as they go through therapy.